Hello, everyone. I'm Bert Eichel, the Health Officer of Mobile County. Today is December the 30th, 2021. First, I'd like to wish everybody a Happy New Year as we move forward towards the New Year celebration. Also, with COVID, we still have increased community activity with community transmission still high. The one testing site, 50% of the people tested were positive. Our site, we tested almost 900 people, 800 people, and we had 30% of the persons testing positive. To refresh everybody's memory, 5% is considered an acceptable, good, or reasonable percent positive with this particular illness. The new variant seems to be displacing the Delta variant. So the Omicron seems to be much more contagious than the Delta variant, and over 50% of the cases that we send out for sequencing to find out whether it's Delta or Omicron in Mobile County, Alabama. By having such infectious status of the COVID virus, it's obviously leading to more people getting ill, and we're having an uptick in hospital admissions in the Mobile County area. The exact numbers, today we had 52 persons in the hospital with COVID. On December the 25th, on Christmas, we had 22. So basically we have doubled between Christmas Day and New Year's of the number of persons in the hospital with COVID. We have had 2 deaths reported in the past 24 hours. And what we're really trying to do is avoid people getting sick. So the mask is extremely important. You need to get vaccinated. If you're not already vaccinated, you need to get your booster shot. It has been proven that the booster and the vaccination decrease your likelihood of catching the COVID virus. We know that people are relying on primary immunity, which means that they had COVID previously, they are 6.5 times more likely to get COVID a second time than somebody who's fully vaccinated. So the data is real clear. Interesting thing on Omicron, it seems to be that persons who had the Delta variant may not have good immunity against the Omicron variant. So there's a reason to get vaccinated. It's founded in science, not as myth. If you have not get vaccinated, please have a discussion with your primary care doctor, somebody you know and trust. We'd like to see COVID community transmission levels go down below 5% again, which we seem to have enjoyed several weeks ago. But this is a different day, a different form of the virus. We don't know all the answers about this particular variant, but we're learning quickly. So as you move forward to the holiday season, advice from the health department is, 1, make sure everybody's fully vaccinated and gotten their booster shot. 2, if you're going to socialize with people who you know their vaccine status so that they're fully vaccinated also. If you don't know their vaccine status, wear a mask. It's very easy, doesn't cost any money to speak of, and it's very, very good piece of personal protective equipment. And the last thing we want to encourage people is don't congregate with strangers. At this point in time, we need people to be very, very conservative. Take care of your friends, your family, your loved ones. Celebrate the new year, but do it in a way that is not going to get you or your family members sick. It's an opportunity. We will get through this as we've gotten through the other 3 waves of COVID. We hope this does not take as many lives as the previous waves have, but we just don't know. It's kind of like the first quarter of the football game. What's going to be the final score? We don't know. So everyone, have a happy new year. Be careful. Enjoy your friends and family. Encourage them all to get vaccinated. And please, please, please be safe, wear a mask, and we look forward to talking to you again in 2022. Thank you, everyone. We can do this again. It's inconvenient. I'm tired of it. I know you're tired of it, but we will overcome this wave of COVID. Thank you. And now, Dr. Murphy is going to give you some facts and information.
All right, thank you, Dr. Eichel. Hi, everyone. Happy Thursday. For most of us, this is the last work day of the week because most businesses, or many businesses, observe the federal holiday of New Year, which is on Saturday, but the federal holiday is observed tomorrow. So our offices will be closed to the public tomorrow, so we're here to give you our Facebook update of the COVID-19 pandemic on Mobile County. So it's going to take a deep breath on this one. Yesterday, we had 977 cases reported to us. I said a couple of days ago when the number jumped up so high in the earlier part of the week that we may be on track to triple the number of cases this week compared to last week, but I think it's actually going to be much worse than that. It's going to be more than a tripling of the number of cases. So we'll see what things look like when we come back to you again on Monday. So we have a total of 78,093 COVID cases, 2 additional deaths. Both of those occurred in December, one of them just a couple of days ago. So we do still see a very small number of COVID deaths, but people still are dying with COVID-19. So we really, our hearts go out to the families and friends and coworkers that are affected by these untimely deaths. Again, the overwhelming majority of COVID hospitalizations and deaths can be prevented by getting vaccinated. These vaccines are safe and effective, and there is a great an abundant supply of them. So anyone who is 5 and over can get a free, safe, and very effective vaccine that can prevent hospitalizations and unnecessary deaths from COVID. Dr. Eichel mentioned that the number of hospitalizations is going up, so I won't revisit that. Yesterday, there were 52 in the hospital. So just a couple of announcements. I just want to review some things that have information that's come out, guidance that has maybe changed or been updated slightly. Even just this week, things are starting to change so fast that sometimes when I give an interview at 10 o'clock in the morning by 2:30 Facebook Live, what I said is already changed. So please, stay tuned and to the most recent information. The big thing this week is that CDC sort of suddenly, much to the surprise of everybody in public health, released a media statement shortening the duration of isolation and quarantine to basically to 5 days. And on a call yesterday where they were talking to public health partners about their reasoning for doing this and doing it so quickly, they really are trying to be nimble and react to widespread impact of Omicron variant in sort of making it difficult for businesses and healthcare settings and agencies and, to keep workers, because so many more people are getting Omicron than we've seen before. It's affecting, sectors, or affecting employees in all sectors. So restaurants are having trouble keeping staff. Schools will be having trouble. Our agency has a few dozen people who are out with COVID. Hospitals is a challenge to keep staff working. So in order to sort of, prop up or sort of maintain critical functions and infrastructure, CDC felt it was necessary to shorten the duration of isolation and quarantine. There is also growing science. Science is not settled on it, but there is growing information that when you're infected with Omicron, that you get sicker faster. So with Delta and previous variants of COVID, on average, people would get sick 5 days. I think it was 5.1 days. Dr. Eichel, we used to have that stat in our head. With Delta and Alpha and the parent, you on average would get sick 5 days after you became infected. With Omicron, there's information out there, and it's growing, that you probably get sick around day 3. So the thought then is that you're also less likely to be continuing to shed virus, through as long as you did when you were infected with other variants of COVID-19. So a lot of different rationale went into their decision to sort of suddenly shorten the duration of quarantine and isolation for in light of the Omicron variant and such high community transmission of COVID-19, so many people getting infected. So basically, if you are infected with COVID-19, so if you test positive, you need to stay home for 5 days. If you have no symptoms on day 5, you can go about your business. Just wear a mask when you're out. Everybody should be masking right now. So if you are infected with COVID, then stay at home for 5 days. And if you have no symptoms on day 5, then you can leave your house and go about your work or your business around town. For exposure, so if you've been boosted or if you've completed your primary series within 6 months if it's mRNA, or within 2 months if it's Johnson & Johnson. So again, if you have vaccine-induced immunity, right, through vaccination boosting, then if you're exposed, then you don't have to quarantine. You can, wear a mask, a well-fitted, consistently worn mask for 10 days, but you don't have to miss out on work or school or stay at home if you have been fully vaccinated in the last 6 months or if you have boosted. So, and for everybody else, so if you're not vaccinated, if you are unvaccinated, this includes people who've had prior infection. So if you are exposed, we need you to stay home for at least 5 days, get tested on day 5, and then for another 5 days, wear your mask. So again, this is trying to reduce the burden of quarantine and isolation on people, to try to encourage them to stay home, to try to reduce community spread, because again, we need to slow the spread. Right now, with cases doubling and tripling every week over week, even though it is less severe, we will likely see many hospitalizations and deaths. So remember, earlier in the outbreak, we talked about wanting to flatten the curve, right? Try to slow down transmission, to flatten the curve as not to overwhelm our healthcare systems. Remember, in August and September, we heard the stories of, EDs were full, hallways were lined with beds, ambulances had to stay at hospitals because they couldn't offload their patients, and so it would sometimes take hours, many hours for people to get an ambulance that needed one. So we're trying to keep that from happening. And the only way we can do that is to slow transmission, to flatten the curve, as to not overwhelm our healthcare system. That's sort of my biggest fear at this point. I think I mentioned that earlier to a reporter. So another couple of things, I just want to talk about sort of our treatments and therapies in the light of Omicron. So there was the state health department issued a health alert notice through the Health Alert Network today that FDA has issued emergency use authorization for PaxVax to treat COVID-19 infection. Now, this was done on December 22nd, so this is not really new news. This is an antiviral prescribed medicine that can be taken at home that was FDA authorized to treat infection. Again, this one is Pfizer, and it's called PaxVax. What's newsworthy, what's new about this alert that came out is that you have to talk to your physician about it, because there are some side effects. There is also there are some situations where you should not be prescribed PaxVax. You have to meet the criteria. It has to be started within a few days of onset of mild symptoms. But what I wanted to share is that the federal government has purchased 10 million courses of PaxVax and will be sending those to state health departments at no charge for them to be used. And, I think the manufacturer is trying to ramp up manufacture or, making the pills. But an initial 65,000 doses will be made available the first week of January. So although it's been authorized, right now it's still in a limited supply. So in the first couple of weeks of January, these first 65,000 courses, that's it for the U.S. And we'll go through state health departments, and Alabama will receive 780 patient doses for this first allocation. Hopefully, allocations will go up week after week as manufacturing increases, but this antiviral drug is not going to be in great supply in the beginning. So it is still better to get vaccinated with, one of our 3 vaccine products, because we do have plenty of supply of vaccine right now. Please do not rely or think that you'll be able to easily get some of these one of these antiviral treatments in the beginning, because they are going to be in short supply. Just 780 patient courses the first week or two in January for the entire state of Alabama. Then the other therapy that we've had in our arsenal are monoclonal antibodies. Again, these are administered after someone's infected and very early in the course of illness to try to prevent hospitalizations. The 2 big ones that were used to treat people who were infected with Delta and Alpha and parent, SARS-CoV-2, the distribution or the manufacture on those has been paused by the federal government because they do not work for Omicron infections. So Sotrovimab is the only monoclonal antibody product that is available for treating people who are infected with Omicron, and those also are going to be in a limited supply early January. So initially, only about 55,000 doses were distributed. An additional 300,000 doses are going to be available for distribution across the U.S. in early January, including Alabama. And I have heard that the number that we may receive may be in the hundreds. So again, not a therapy that's going to be available to a lot of people in the beginning, though the supply will increase as the manufacturers will ramp up their activities now that the authorization has been approved. Okay, let's see, a couple other announcements, and then there are just a couple of questions. I just wanted to please, everyone, listen. Do not go to the emergency department to get a COVID test. Go to the emergency department if you need emergency health care. If you need emergency health care, go to the ED. Do not go to get a COVID test. We really need your help with this to try to decompress already, very busy emergency departments and overworked healthcare staff. Please go to a pharmacy, one of the urgent care clinics, come to our clinic at Festival Center, go to the University of South Alabama drive-through clinic at the Civic Center. Please go someplace else to get tested for COVID, because we just really need your help making sure that we don't clog up our emergency departments with people seeking COVID tests. And on that, we are increasing our services at our, we call it the COVID Way, at 101A Festival Center at the corner of Montlamar and Airport. We are going to be open tomorrow. So even though tomorrow is a federal and state and county holiday, we are going to be open tomorrow from 9 to 2 at the Festival Center. Then we will be closed Saturday and Sunday. And then starting next week, our clinic will be open 9 to 7, Monday through Friday. Previously, we were only open until 7 one day during the week, but we're going to open 9 until 7, Monday through Friday, and then also we'll be open Saturdays from 10 a.m. to 2 p.m. So remember, you can get your vaccination or your booster dose there, or you can get tested for COVID. No appointment, walk-in only. Please be patient. We have had between 650 and 800 people tested there each day. Each day we have tested 6 to 7, almost 800 people in the past, daily in the past couple of days. We don't turn people away. We stop taking, customers or taking clients or taking patients about 30 minutes before closing time so that we can try to wrap up and get our staff home at a decent time. But be patient, because there is some waiting. Folks are sometimes, as you can imagine, quite nervous and tense and stressed out about the fact that they may have COVID. And so just please be kind to our staff and to each other. And again, just beg for your patience on that one. I did want to mention at the Festival Center that the way people have come to me sharing concern that they have to go inside a place to be tested. And so remember, the Civic Center drive-through location is still open. So please use that resource that's available so you don't even have to get out of your car. At the Festival Center, we try to keep the numbers inside low by asking people to wait in their cars, and then we call you on the phone when it's your time to come into the building. There's still a lot of people in there, but we're masking and trying to keep people distanced, and again, asking people to wait in their cars until we call them to come in for their test. All right, questions. Let's see. Someone asking about the percent test positive. So right now, depending on who you ask, percent positive in Mobile County, depending on the clinic and that sort of thing, overall, it's around 30%. But it can be anywhere from 10 or 15% at, let's say, a private doctor's office, and as high as 50% at maybe a drive-through testing clinic. So a wide range. On average, 1 in every 3 people getting tested is positive for COVID, and those are record numbers of positivity. So it's quite humbling when I'm at the Festival Center and look around and think, wow, 1 in every 3 or 4 people in this room has COVID. It's a sobering thought indeed, and it helps me remember to keep my mask on and to distance and to not go to indoor social gatherings unless I absolutely have to. Let's see, talked about the importance of not going to hospitals to get tested. Let's see, based on the spike in COVID numbers, should the city cancel its New Year's Eve celebration? Well, that's up to the city. What we can say, or what I can say, is that gatherings of any kind increase the risk of COVID-19 transmission. Yes, outdoor gatherings are better, but anytime you do things like have large crowds, not enforcing mask mandates or even having a mask mandate, when you have people gathering from different parts of the state and maybe of the U.S., depending on where, people are coming into town from, mixing of vaccinated and unvaccinated, that all of those things raise the risk of transmission even in an outdoor setting. So if you are going to celebrate New Year's Eve downtown, please go only if you're vaccinated. Wear your mask, keep your distance, stay away from strangers. Certainly don't, kiss strangers at midnight. All of these are really high risk activities. So, we have the highest level of transmission of COVID in the city right now, or in the county right now, than we have seen. Let's see, and those decisions are made by the city and the Downtown Alliance and the businesses and event organizers and that sort of thing. So let's see, Auburn has announced campuses will go back to wearing masks despite vaccination status on January 3rd. What guidance are we giving local school districts and colleges? So y'all, the guidance is the same. With high transmission, we are at a high level of transmission, the highest level we have seen. Everyone should be wearing a mask indoors, regardless of vaccination status. So if you're at a party, or if you're at a college or a university or a school or a grocery store or a church or your neighbor's house for, a gathering, anytime you're in indoor setting, you should be wearing a mask, whether you're vaccinated or not. And the other thing you should do is limit the size of gatherings. Know the vaccination status of the people who are participating in your gathering. Shorten the duration of the gathering. Maybe have staggered your family members. Maybe have the in-laws come at 4 and have the other side of the family come at 6 if you want to see everybody on the same day. right? So there are things that you can do to safely celebrate, to safely gather, but it really takes, some thinking and just using common sense and the tools that we've been using for 20 months now. Were you going to ask me something?
Okay, one media. You're talking about people waiting in the cars at the festival center. What is the way to register upon arrival?
So the question is, how is the registration process at the festival center? So when you get there, you come to the door and they will hand you a clipboard and get your name and telephone number, and then you take your clipboard to your car and you fill out your paperwork while you're in the car, and then someone will call you when there's space for you to come inside and get tested. Okay. The reason we have to do it that way is that our landlords will not allow us to queue people outside. We are not allowed to have lines forming on the sidewalk or in the parking lot. So it's really important, in order for us to keep that space open, please help us comply with the terms of our lease. Let's see, Facebook. Someone asking why the daily report sometimes has a change in the number of cases reported. So, cases are reported to us all day long. So we generally run this report at 10:30. So if 2 days ago the number was 435 at 10:30, and then the next day it jumps up, it's because additional cases were added on that day. Do you report on new cases by vaccination status? So unfortunately, I and my data scientists, we do not have access to the raw data that's in the immunization registry. We do have access to the raw data that's in the case registry. So we here locally are not able to cross-reference those two data sources, the cases and the immunization records. Here locally, we're not able to cross-reference those and report out on the percent of people who are getting COVID that are vaccinated or unvaccinated. The State Health Department in Montgomery, they can do that. And so I get a weekly report for internal use, and things have been a little slow because of the holidays, but we'll be picking that back up. Hopefully we'll be getting that information next week after everyone returns from the holidays. Still, overwhelming majority of cases and hospitalizations are in unvaccinated. I just don't know the exact percentage right now. Let's see, someone asking about more drive-through testing sites. So there is at least one, and then, at the Civic Center, and then there are some other pharmacies, I think, that do testing by drive-through. Let's see, how do we know if it's an Omicron variant? So the rapid test or the PCR test can't distinguish between Omicron or Delta or Alpha or any of the parent strain. But what happens is, the way we've been able to say is that we have a partnership with local laboratory, and we have been working with hospitals to get specimens from PCR positive patients sequenced. So the laboratory sequences the entire genome that is in the specimen, and from that genomic sequencing, we can determine what variant was in the specimen. It's very expensive, it's very time consuming, so we only do that on a small sample of the specimens that are positive each week. Let's see, someone asking, is the infusion effective for Omicron? The current sotrovimab is the only monoclonal antibody treatment that is effective against Omicron, and I believe it can only be administered intravenously. Do you know? I think that's right. So that's what I think you mean by infusion. So there is one available. It's in extremely short supply right now. It will continue to be in short supply. It has to be administered at a hospital or a healthcare setting. What medications should patients expect at a time of diagnosis to prevent severe illness? The only things we have available are monoclonal antibodies, antivirals, and remdesivir. Those are the three classes of treatments that we have right now, and except for remdesivir, the others are in very short supply, and remdesivir is not, super abundant. So right now, your best path is to prevent infection. Get a vaccine to prevent severe illness and death. We have plenty of that. Someone asking to share the data that indicates that people are 5 times more likely to contract COVID again if they're not vaccinated. So I believe they saw this infographic. Sorry, I just have the black and white version of it. And I think Mark already commented on this on Facebook, but there is a publication from the Centers for Disease Control that states it was examining 7,000 people across 9 states in 187 hospitals that compared, COVID positive with people who were vaccinated and who were unvaccinated and who had previous infection 3 to 6 months before. And the finding was, let me read it right here. Adults hospitalized with symptoms similar to COVID, so COVID-19 symptoms, unvaccinated people with prior infection within the past 3 to 6 months were 5.49 times more likely to have laboratory confirmed COVID-19 than those who were fully vaccinated during the same time period. So if you had COVID 3 to 6 months ago, you were 5.5 times more likely to get COVID than someone who was fully vaccinated 3 to 6 months prior. Should active cancer patients who had a booster 6 months ago plan for another booster? So we weren't doing boosters 6 months ago, but in general, yes, you should get a booster. So the booster timing is if you had Moderna or Pfizer, then it's 2 doses, right? You might have gotten a 3rd dose. There were some people who were immunocompromised who were authorized to get a 3rd dose back in the summer. And people did that. And maybe this Facebook viewer is in that category. Maybe you had 2 doses of a messenger RNA vaccine, either Pfizer or Moderna, and you got a 3rd dose. So yes, if you were in that category of immunosuppressed and you got 3 doses, you should get a booster 6 months after your 3rd dose. Hope that's clear, and if it's not, call me and we'll talk about it.
Is the PaxVax available for use?
PaxVax, it is, but I don't think it's shipping yet. It's been authorized for use. I don't think that the pharmacies have it yet. Dr. Eichhold is shaking his head no, so it's not available yet, but should be early January. Anything else, Mark? Okay, Mark's giving me this sign, which means we're done. Thank goodness. So again, please enjoy your holiday. A lot of us are have mixed emotions about coming to the end of 2021 and going into 2022. Last year, this time, I just kept saying, I don't think I can do COVID another year. And here we are another year into it, and we're about to enter our 3rd year of dealing with COVID. So it's here. We're having to adapt, change the way we live in many instances, the way we act and interact with our community and our friends and families and coworkers. And so let's, celebrate with family the end of the year and the future that comes with a brand new year. Please be safe out there. Consider changing your holiday plans to, a smaller gathering, a shorter gathering, a safer gathering, and Happy New Year, everyone.